Hi, my name is Danielle Woods and I'm an adult nurse lecturer at the University of Bradford, and I'm here today to talk to you about adult nursing and what is adult nursing. I've been a nurse for over 20 years and it's offered me a variety of opportunities across the field of adult nursing. So if anybody knows how exciting being a nurse is, it's me. And you know, nursing in general and adult nursing can offer you a variety of career opportunities. And here at Bradford, we have an excellent employment opportunity at our local hospitals. So what is adult nursing? Adult nursing, it's not just about the medical sides of things. It's not just about the physical things like taking somebody's blood pressure or seeing to their hygiene needs or giving them medication. It's so much more. It's really about looking after the person as a whole. And that's what we teach now. Is like, instead of a patient coming in with tummy pain or with head pain, it's about that person as a whole. And never, one day is never the same. And when you come to university, we teach you how to do this. And we teach you through a variety of different learning experiences, because we understand that students learn in a variety of different ways and that they have different strengths. So we want to be able to accommodate this, and we do this through how we design our teaching and how we design our clinical simulation experiences that would be offered to you. So as you can see, there's a variety of things on this slide, and these are the kind of things that I think represent nursing. So we are the backbone, really, of the institution of the NHS. We can't function without nurses. Nursing can lead you all over the world. You don't necessarily have to work and train wherever you've been at university. It can take you the length and breadth of the country, or you can even go abroad if you wanted to. Nursing is all about listening and looking, observing and seeing what goes on. And with all the clinical experiences available to the University of Bradford, you'll be exposed to a whole variety of different clinical experiences, from accident and emergency to intensive care, to medical wards, to surgical wards, to very speciality wards like haematology and oncology, theatres, but then also what's out there in the community, visiting people in their own homes and understanding what that means for you as a nurse and how that feels for a person as well. We don't just look after the patient though, and this tree here represents the whole of the family. We look after the whole family as well, and we make sure that family or carers are included with everything that we stand for as adult nurses. The spaceship there represents future forwarding. We're always looking at what the future adult nursing care looks like and what does that involve. And that's about us creating things that keeps you current and up to date, and using innovative technology. I've been an adult nurse for over this last 20 years, and it gave me a massive experience. I worked in accident emergency for the first 15 years. I then became a lead nurse for dementia within the same hospital, as well as juggling all other kinds of things that are going on within my life. And what we do at the university is we help support you through that training by providing you support in a variety of ways, on a personal level, your personal academic tutor, but also from different support services within the university itself. And what I just wanted to show you there is just how becoming an adult nurse, you can start in one career, but then you don't know where you're going to end up in 10 years. And that's what nursing offers you. You can start in one career, and then in 2 years' time, you might decide to go on another career. And then you might decide you want to specialise into something else. And then eventually then, as you can see a picture of me, I came back to the university to give and share my experiences with you. So the personal qualities that we're looking for, you need to be able to demonstrate your compassion, because that's something really important that we need to see within nursing, is how do you demonstrate your compassion? That's not just being able to do physical skills like all the clinical skills that we teach you, but how do you demonstrate being able to listen to somebody by being able to talk to somebody and using a variety of communication skills? How to talk to somebody and give them some bad news. That's really, really important, and that's not a skill that everybody has. Within the adult nursing team, we all come from a variety of different backgrounds. We all have lots of different experiences. We can share them with you. And we also use that when we're creating the nursing curriculum. And what's exciting is that we also facilitate learning in very different ways. We use simulation. We use lots of different types of digital platforms. For instance, an example, I created a major incidents scenario where students were able to simulate what it was like being in a major incident, and then they followed patients' case studies. So it's a mixture of being able to do something theoretical and something academic, and then having something visual that you can then apply your theory to. And that's really important, and that's our ethos throughout, is that we give you some short snaps of learning, and then you're able then to take that and physically adapt that to something that you observe, or that you can physically touch through clinical skills, or when you go out and practice. And that's really important. And again, that also supports people's different ways in learning. We want passionate people. We want people with a good sense of humour. We want people who are realistic about the amount of work that they've got to do. Those people are really particular to that attention to detail and the amount of responsibility that you're going to need to be a student nurse. To be able to think on your feet, but also work within a team as well. And that's really important. So if you feel that you've got those skills and you want to help somebody, then adult nursing could be for you. If you've got any inquiries that you want to know a little bit more about adult nursing, then why don't you get in touch with the general inquiries team at Bradford, or you could either get in touch with the admissions team, which is admissions@bradford.ac.uk, and they may well be able to give you some more detailed information, particularly around the qualifications that you need for the course. If there's any specific questions that you might have about adult nursing, then the admissions teams will be able to point you into the right direction.